Dr. Jay Burton has a unique perspective on surviving cancer with both a physician's and a patient's point of view. A primary care physician with Springfield Medical Associates, Dr. Burton was diagnosed with acute myeloid leukemia in 2010. During his recovery, he came to recognize the need for improved primary care for cancer survivors, and the Primary Care Cancer Survivorship was born. Connecting Point intern TJ Hannigan and producer Dave Fraser visited two of those support groups to share their story.
I'm a cancer survivor. I was diagnosed with acute myeloid leukemia in May of 2010. As part of my treatment, I've had chemotherapy and radiation therapy, and I also had a stem cell transplant in October of 2010. I was trying to decide what I wanted to do with the rest of my life, and that's why within my practice, Springfield Medical Associates, we've established the Primary Care Cancer Survivorship Program because we want to take care of cancer survivors.
Very quickly we recognized the need to offer more services in the Western Massachusetts area, more cancer survivorship services, and survivor journeys came out of that. Our groups are terrific. There's a camaraderie of people in the group, and we come in, we have a very relaxed environment. It's confidential, it's emotionally safe. We don't use any structured curriculum, so we just begin by saying our names, what our diagnosis is, and let it flow from there. People can feel free to say as little or as much as possible. I typically see shock by the news of a cancer diagnosis, fear, anger, panic, not knowing where to go, what decisions need to be made first, and ultimately treatment and survivorship.
What I realized is that when the oncologist says to the patient, "You don't need me anymore," the patient sometimes feels abandoned. And this is someone who helped them through the most difficult time of their life. And then they don't know where to go and who to turn to.
People don't understand what they're going through. It's easier to communicate with people who've been through the experience or have had loved ones go through the experience, knowing that there's help and there's support out there.
My goal by coming is to tell them and help them express what they want to say. Don't hold it all in, because here's the place to do it. Nobody's going to judge you, nobody's going to question you, and nobody's going to make you feel guilty about those feelings that you have.
I just needed to talk to people who understood. You know, you could call your friend on the phone and talk about how you're feeling, but you don't understand it till you've been through it. So this group of women, granted they've all had different stages of it and been through different kinds of treatment, they understood where you're coming from. So we could all share stories, we could laugh about things, and it really helped.
We talk about how we've been feeling, what our hopes and aspirations are for the future, and where we actually all are upon our journey. So we do help each other. We're all a source of strength.
The unknown is what gets you. You know, if you're educated about things, you know, you're well versed on it, it's much easier. So that's what we try to do, is educate people, make them comfortable.
The most surprising is resiliency, is the resiliency and the courage that people show when faced with a cancer diagnosis. That they're able to get up and put one foot in front of the other and become a survivor. It's amazing to watch.